Coronary artery calcium scanning. The coronary calcium scan is a test that measures the amount of calcium in the walls of the heart's arteries. Now, that's because deposits of calcium in the coronary arteries are a sign that there may be also a buildup of plaque. Plaque is a waxy substance that can harden over time and narrow or block the arteries. When this happens, it causes a heart attack. What does after a coronary calcium scan the results mean? The test result is given as a number, and this is called a coronary artery calcium score. Now, this can range from 0 to over 400. Basically, the more evidence of calcium and thickening that is seen in the inside lining of the arteries, the higher the score. The higher your coronary artery calcium score, the more likely one is to develop heart disease or have an event such as a heart attack or a stroke. This is the scan being done in a high definition scanner. Takes about 15 minutes. Now here we see the coronary calcium scan showing a calcified plaque in one of the major coronary arteries. Now this white part of the image is the plaque. This is a normal coronary scan that does not show a calcium deposit. Now this very clearly shows a calcium deposit blocking presumably the left anterior descending coronary artery. That is the coronary artery, and this is the gradual accumulation of plaque, a waxy substance which narrows the lumen, and at one point, if this blocks, a heart attack will result. The test does not use contrast dye and will take about 15 minutes. A coronary calcium scan uses a special scanner, and this is called a multi-detector CT machine. A multi-detector CT machine is much faster than the conventional CT scanners and makes high-quality pictures of the beating heart. A coronary calcium scan will determine an Agatston score. Repeat that, Agatston, the Agatston score that reflects the amount of calcium found in the coronary arteries. Normally the score is 0, and in general, higher the score, the more likely one is to have heart disease. If the score is high, then the requisite sequelae can happen and the recommended treatment must be taken. Now let's have a look at what do you mean by the Agatston score. It is named after its developer, Arthur Agatston. It is a measure of calcium on the coronary CT calcium scan. The score is calculated using a weighted value assigned to the highest density of calcification in a given coronary artery. The density is measured in Hounsfield units, and a score of 1 for 130 to 199 Hounsfield units, 2 for 200 to 299, 3 for 300 to 399, and 4 for 400 Hounsfield units or greater. An Agatston score of 4 means that the artery is almost getting to be occluded. Now, what is done when such a thing happens? Here is the coronary vessel. This is the right and the left coronary, the anterior descending and the circumflex, and here the anterior descending is undergoing accumulation of plaque and narrowing. What your wonderful cardiologist will do is to insert a stent, dilate or expand it such that it compresses the plaque and permits good flow of blood. Now, this can preempt a potential heart attack and save precious lives. That is the importance of a coronary artery calcium scan. That is your heart beating. Take good care of it.